raise your brow. So we want to get a little bit of a lateral lift here, so relax now. So we're going to stay high here. Okay, raise your brow. You can see she's got contribution of the frontalis all the way across, even here in the center. So relax your forehead now, and her brow is in good position. She'll get a little bit of lift with the corrugator injection. So I'm going to come high here in the forehead. Raise your brow again. Relax. I'm going to treat her frontalis just on one side here. Raise your brow again. And then over here, in a triangle pattern. Raise your brow again. And that should take care of this main action she has here, and this that she has here. We'll put the last right at her hairline. Don't forget to check her hairline. Sometimes we treat well here, and then you start to see wrinkles up here. So whenever we're injecting a Botox, we always like to have the patient move so that we can see the contribution of the muscle. This is the contribution from the frontalis muscle. So just about 10 units of Botox in this region should be plenty. Okay. Her frontalis muscle goes all the way up to her hairline, so we do need to treat there, and far lateral. So if I only treat here, she's going to have wrinkles here, and she'll get that funny Spock look. So we need to make sure we treat everywhere all the way across. Now she doesn't have wrinkles here, and she's getting a little bit heavy here in her upper lids, and if we go too far down, she'll get a very tonic look here. So we're going to treat high and just treat these wrinkles. Okay, raise your brow again. Good, now relax. So here we go. Now this is going to be another 10 units of Botox, and I'm going to spread along her forehead. Raise again. Good, relax. Raise again. Good, relax. A little bit more. All right, so I'd like you to raise your brow, frown your brow, and smile.
I can't feel
it. You can't feel it. All right, we're going to use 20 units of Botox and treat the entire upper face. So we're going to cheat every area just a little bit. So smile. I'll put my finger here in the orbital rim and do 2 injections where she has the most wrinkling. There you go, unsolicited. Okay, frown your brow. Very mild procerus, so I'm going to put just a little bit there. Then frown again. Good, now her corrugators, the bulk of them are here, but she's still pulling from here. So I'm going to sort of split the difference. Frown again. Good, relax. Good. Now raise your brow. Good, relax. That's where she has the most motion. I'm going to go all the way out lateral here. Raise your brow again. Good, relax. All the vessels here that we're trying to avoid. Raise again. Good, relax. Raise again. Good, relax. Raise again. Good, relax. Raise again. Good, relax. Finish this closer. Good. Raise your brow for me. We're going to treat her forehead, and you can see that the forehead lines go all the way from temple to temple and all the way up to her hairline. So if I only treat centrally here, she's going to get a funny pull of her brow. Also, if I only treat down here, she's going to have creases up here. So I want to treat really the whole muscle. Now relax your brow for me. Her brow is not too low, even though she's got a little asymmetry of her eyebrows. Her brow is above the orbital rim, so I'm not worried about brow ptosis. She does have a lot of lines though, because she's getting a little bit of heaviness of her upper lids. So I have to be careful not to overdo it, not to drop her brow and accentuate this heaviness. So I'm going to go lightly on her forehead, do a little bit here in the corrugators to give her a little bit more of a brow lift. Okay, good, relax now. So we're going to march right along forehead. Raise your brow for me. Good, relax. Okay, raise your brow again. Good. Frown your brow. Good, relax. Frown again. Good, relax. So she's got a low brow, and I don't want to treat very low because it's going to drop her brow. But she doesn't like these wrinkles here, which certainly I can treat those and still allow her to raise her brow. So we're just going to treat right in the frontalis muscle, just along the hairline. It's an important area to remember to treat, because sometimes if you don't treat it, people will end up with a ridge of wrinkles there. Okay, now frown your brow. All right, so now we're going to treat the corrugators. Frown again. Good, relax. You can see she's got a long muscle. It's all the way out to here. If you don't treat the whole muscle, they're going to end up using accessory muscles to pull things in and think that the Botox didn't work. Okay, turn towards me a little bit. Good. So frown again. Good, relax. Muscle comes all the way out to there. She's got a long muscle. So we're treating with about 18 units because we're going to save a couple for her orbicularis muscle. Do a little in her procerus. All right, so smile for me. When she smiles, she bunches her orbicularis muscle here. So I'm going to put 1 unit right in her mid-pupillary line. Look up for me. Little pinch. Does not have to be deep. She's going to get a little more of an eyelid show. It's going to bring her lid down just a little bit. So mid-pupillary line, we're going to go right in her orbicularis muscle. And that's it. Done. We're going to be injecting the forehead and the glabella now with Botox. Raise your brow for me. She has an extremely high forehead with ridges that go all the way up to her hairline. If I don't treat that and only treat here, she's going to be nice and smooth here and then have all these ridges here and will not be happy. So I need to make sure I extend it all the way up into the hairline. Frown your brow for me. And then we're going to treat the corrugators here. You can see where they're inserting. She's got a long corrugator. She's a little short lady, but a long, long corrugator. And I need to make sure that I inject all the way out to where it attaches to the skin. Okay, you ready? Here we go. I'm going to start with the procerus. I always start here because it doesn't hurt people very much. Frown. Good, relax. I'm looking through the skin and I'm looking exactly where the muscle is. Frown. Okay, I'm going to come just a little bit out here, superficial. Frown again. Good, relax. Frown again. Good, relax. Can you make sure that that is still okay? Yes. Still okay? It's good. Now we're going to inject her forehead. Raise your brow. She has these little crescents here that I don't want to have her be concerned about. So we're going to inject where those little crescents are. And then I'm going to march along her forehead. I'm using a total of 20 units of Botox. I could also use 60 of Dysport. I find with Dysport, patients get a little more motion, so sometimes that's nice for a more natural look. If they want no motion, I prefer Botox. Okay. Now we're going to treat the forehead and brow complex. Raise your brow for me. So she's got some motion here, plus these crescents here that people really hate. So we're going to treat that and then frown your brow. She doesn't have terrible movement of her corrugators, so I'm going to split a 20-unit dose between her corrugators, procerus, and forehead. So frown for me. Good, relax. You can really see the action of the procerus here, looking through the skin. Frown, relax. And frown again. Good, relax. I'm looking to see where the muscle inserts onto the skin, and I get a little more superficial with the injections at the insertion. Frown again. Good, relax. Now raise your brow. You can see her crescent here. I'm going to inject a little bit higher above that crescent and relax that. Raise again. Good, relax. Now raise your brow. Good, relax. So I'm going to just go straight across her forehead. Again, trying to avoid the vessels, trying to be intramuscular. Sometimes people with very high foreheads get a nice result here and then they have ridges here. Raise your brow. She doesn't really have a lot of creases here, so I think with the degree of treatment of the spread of the Botox, this should be okay. If she would come back and complain of extra creases up here, I could certainly put a few more units of Botox up there.